When a patient comes in with a depressed mood, alongside fatigue, anorexia, or memory impairment, maybe even loss of libido, you should be thinking about major depressive disorder. But remember that there are definitely organic causes or medical causes of depressed mood. For example, if my patient has some salt craving and if part of their body hair is being reduced, you may be thinking about primary adrenal insufficiency. This is also known as Addison's disease. A quick pathophysiology of it is basically when you have destruction of the bilateral adrenal cortex, and you basically have three things that happens to the patient's body. Number one, of course, you have mineralocorticoid deficiency. This causes salt wasting, and when you lose salt, you also lose water with it, so the patient has hypotension. They can experience weight loss, hyponatremia, hyperkalemia, and also, of course, the patient is craving salts. The next is glucocorticoid deficiency. So when you have loss of glucocorticoids, you clinically can present with fatigue, anorexia, and psychiatric manifestations, such as irritability or depressed mood. And also, because steroids are important for the blood pressure in the body, these patients also present with hypotension. The last thing in primary adrenal insufficiency is androgen deficiency, and this can lead to the loss of libido that I talked about earlier, or reduced secondary sexual characteristics like pubic hair. Now, a very quick fact about the androgen deficiency: you usually only see this in women because androgen production is mainly in the testes of men. On the topic of adrenal insufficiency, remember that salt craving isn't the only thing that patients look for. You also want to look on their physical exam hyperpigmentation, especially if you're suspecting for primary adrenal insufficiency, because secondary adrenal insufficiency would not have any of the hyperpigmentation. Now, the best way to diagnose primary adrenal insufficiency is stimulation testing with Cosyntropin. This is a synthetic ACTH, and what happens is you give them a synthetic form of this ACTH, and you would expect an increased amount of cortisol. And if the patient has a low production of cortisol, then this is highly characteristic of primary adrenal insufficiency. If the patient doesn't have any dietary salt craving or any reduced secondary characteristics, but let's say that they have some mood changes, some maybe memory loss, and let's say that they were a long-term smoker, well, you can definitely think about small cell lung cancer, maybe even Hodgkin lymphoma, because these can cause paraneoplastic encephalitis, and this can manifest as some mood changes or memory loss. Let's say that a patient comes in and they're not eating, they're having some anorexia, and they have a history of major depressive disorder, but they don't have any of the mineralocorticoid symptoms or glucocorticoid or androgen symptoms. When you think about a case like this, you definitely want to get a detailed nutritional history. You may be able to diagnose anorexia nervosa here, especially if their BMI is less than 18.5. Now, what if they are a frequent drug user? Well, don't forget that acute HIV infection can present with some fatigue and weight loss, but you also want to look for hepatomegaly or splenomegaly. I know I'm throwing out a lot of other diagnoses here, but remember that when it comes to step 2 and just in medicine in general, that just because someone presents with some type of psychiatric condition, it's important to take a step back and look at the whole picture, because it's important to tackle psychiatric symptoms with an integrative medicine approach.